So for my top 10 things to learn more about, my topic is health literacy. Health literacy is a set of skills that an individual has to process information and function within the healthcare environment and how they can make decisions. It's related to a personal understanding, personal use. It also can be applied to organizations. Are they providing information at a literacy level that is available and understandable to those around them, or the ones that they're providing care for? So this is a map of the country and showing what counties are high in literacy and what counties are low in literacy. The yellow is high, the darkest blue is low. So we have lots of room for improvement in our country. Health literacy is related to literacy. One thing I found interesting is that a little over half of our population, adult population in the United States, has a 7th grade level, reading level or less. So this is really an important thing to remember as we interact with individuals in a healthcare setting, is that are we using jargon? Are we using words that might not be understandable to most of the public that we're interacting with? CDC has some talking points about literacy. 9 out of 10 struggle to understand health information and jargon. So we need to be careful about how we're speaking, and are we using everyday common words to help people understand better their own health situation. Health literacy is costing our healthcare system and our nation money. And basically the way to improve health literacy is to have better communication strategies, clearer, more understandable ways of expressing health information. For example, our pain scale is simple. It uses pictures to help describe. A 3-year-old can point to the picture and tell you how much pain they are in just because it's a picture, and they can understand that. So we need things like that to help with our literacy. Also, individuals who have a low health literacy tend to have worse health outcomes. They tend not to get their preventative care or preventative screenings. So when there does become an issue, it's worse, it's more chronic, it's more advanced, costing more money for our healthcare system. Also, seniors are the age group that have the lowest health literacy rate. And I think this is probably due to their processing, their mental processes are slower, and maybe we talk fast or over them. And then finally, here are just some quick tools that can be used when developing communication. In the healthcare setting, CDC has the communication index with words that can be used in place of jargon, medical jargon, to help other people, help people understand. And then BYU has a literacy toolkit, which is kind of a cool thing. They have several scales already vetted and measured and easy to use. A lot of them are in different languages. So if you have a patient or a client that doesn't speak English, you can give them this test in Spanish, and you can judge where they're at in their literacy and their understanding of several different types of chronic issues: heart disease, cancer, depression. Also, Microsoft has a tool that you can use to measure your writing and if it's a 4th grade level or not. Anyway, that's what I learned, and I hope you learned too.